This is the beginning of a war. It is a war to reclaim our health.
In 2008, USA Today published a news story that stated, "If we look at the data objectively, we are spending too much on AIDS. About $10 billion a year is spent on AIDS, while 2 billion people live with no sanitation. 1 billion lack access to clean water. And malnutrition kills someone every 10 seconds. These factors enable diseases to thrive and severely weaken the immune system of those living in such squalor."
If we were to take all that money and put it towards developing poor countries, God would be so proud of us, indeed, because we would have taken away the major challenge that's facing humankind, and that is people dying in silence. It's slow, painful deaths from being scared of something that was just packaged as AIDS.
Could it be that the real epidemic is extreme poverty, not HIV? On the other hand, HIV allegedly occurs in the United States as well. So I looked for alternative causes of immunodeficiency in this wealthiest of nations.
There are other ways you could produce a condition that looks like AIDS, but they too will be some source that causes a severe defect in the immune response.
19 million Americans now, 19 million, are taking illicit drugs every day. But we don't talk about this. This is politically incorrect.
There have been a number of theories as to what the origin of HIV/AIDS is. One of them was a theory that certainly turned out to be completely incorrect, that it's a lifestyle phenomenon.
There's a large epidemic of STDs in general in the late 70s, and particularly in gay men. In San Francisco, New York, Los Angeles were meccas of the new lifestyle, which came from the liberation in the post-Stonewall era.
The more partners you could have, the more you were striking a blow for gay lib. I remember talking to one of the people who was at the forefront of that lifestyle. It very much felt like if he did have another bout of syphilis or gonorrhea, whatever it might be, that it was like a notch, a victory notched up for his right to exist as a gay man.
I went on a vacation to Los Angeles, and it wasn't that wild, but one night I went to a bathhouse. I came home with, get this, at the same time, syphilis, gonorrhea, and 2 forms of parasites.
I have no views about that, in a judgmental kind of sense, but certainly from a public health point of view, that's kind of a prescription for disaster, because AIDS first occurred in these men who were not healthy for reasons that were obvious to everyone.
You're talking thousands of partners, sometimes hundreds, per month, lots of antibiotic use, lots of drug use, and the result were people were getting pretty sick.
There's a drug called amyl nitrate that was developed in the 1850s and 60s. Came in ampules, and they became known as poppers because you'd pop them when you open these ampules up to sniff them when you had coronary artery disease. The first AIDS cases, for example, that Mike Gottlieb reported were all 5 gay men. They were young. They all used poppers.
Poppers, something you walk around huffing all night. I mean, it says flammable, fatal if swallowed on the side of the bottle. They're walking around huffing it all night long. Why? Gives you a great rush.
Poppers was a sex drug. They were in every gay bathhouse, every bar, every porno bookstore across the nation. Poppers were visible on the dance floor in the discos. At the end of an evening, the bartender would announce, "Last call for alcohol, last call for poppers."
It was like a mad, wonderful kind of a dance that was being done. But if you think that can happen forever, you're wrong.
Whether or not HIV exists, whether its role in a weakened immune system is almost irrelevant when you compare it to what was going on at that time.
The lifestyle explanation proved politically unacceptable, but the virus explanation proved very, very acceptable to many different parties.
Pneumocystis pneumonia and Kaposi's sarcoma were the hallmark
diseases for AIDS in the early years.
To go back and deconstruct it and say, what exactly did cause pneumocystis carinea?
I remember the first patient that I ever saw, my resident brought me to see a young gay man with pneumocystis pneumonia. I knew a little bit about the use of poppers or amyl nitrite inhalants, and I started asking the patient if he used them, and it turned out that he was a very heavy user of amyl nitrites, and much to the surprise of my students, I said, I think the man probably has destroyed his pulmonary immune system by inhaling this toxin.
What exactly caused Kaposi sarcoma? We know that now. It was amyl nitrite.
We saw KS decline, interestingly parallel to the decline in popper use.
We now know that Kaposi sarcoma is caused by a second virus, the human herpes virus strain 8.
To rescue comes another virus. As always, when you're in trouble, you find another virus.
If one wants to look at really what causes this, we've got to look beyond just HIV and just beyond HHV8.
Calling it a disease, see? And to give it that name, AIDS. So everything's included under that, and you don't have to just say, I mean, if you'd have said, you know, these people are getting a lot of weird diseases, all kinds of diseases, it wouldn't have had the same impact. It was much better to say, there is an infectious organism on the loose in America, and it could get you.
I had interviewed the world's leading HIV experts and discovered that the two benchmark diseases of AIDS have alternate explanations. Once again, I turned to Dr. Gelderblom, seeking proof of HIV's existence in the most recent images available.
Here, you do not see anything about the details, but I would say it's probably a virus.
These are HIV here?
Yeah.
Oh, so are these HIV too?
Yeah, yeah.
Everything's
Probably.
Probably.
Yeah.
What can I tell you? You know, I mean, it exists. Gallo said he had all these viruses, and it was a lie.
I think HIV totally has turned out not to be the cause of AIDS. HIV has turned out not to be.
Gelderblom's images, said to come from isolated HIV cultures, provided no proof for HIV's existence. So I asked Nobel laureate Dr. David Baltimore and Dr. Robin Weiss how they would isolate and photograph this elusive virus.
Well, didn't Dr. Gallo do that? I mean, he actually isolated it, so... Yeah. I mean, why should I do all of this? This is all textbook stuff you're asking me.
I'm not quite sure what's behind your question about isolation.
I don't want to be your textbook, you know? Okay. I got other things to do.
They're embarrassed. The scientists have been embarrassed about this. They know that it's flawed.
In 1987, the CDC made two mind-boggling changes in the definition of AIDS, which are in effect today. You can be diagnosed with AIDS without ever having an HIV test.
In 1987, I had a lesion on my arm, and it was KS, Kaposi sarcoma.
The doctor diagnosed you with AIDS without an HIV test?
Yeah.
You can be diagnosed with AIDS if you've tested negative for HIV.
Alvin Friedman Keene found 16 patients with Kaposi sarcoma among gay men in New York City in the 80s. They did not have HIV infection. Yet they had AIDS by our definition, right?
In a World Health Organization publication, Dr. Chin writes, "It should be emphasized that the surveillance definitions for AIDS were not intended to be reliable indicators of HIV infection."
If you have thousands of documented cases of AIDS without HIV, how can HIV cause AIDS?
Why do you believe that HIV does cause AIDS?
Because that's all the information that I've been given.
Because we've never been taught anything different. We have read it, heard it.
Because that's what the scientific community has told us.
Scientists are supposed to observe, experiment, and reason from what they observe. They're not supposed to grab hold of an idea and cling to it and adjust everything else in their perceptions to fit that idea.
I think an HIV positive test means that your life is forever changed. You have a whole new battery of things to consider for yourself. What does it mean to me?
It's very